Government and opposition politicians love talking about frontline staff in public services, but there's a crisis looming in the medical world because of a shortage of those unfashionable backroom staff. Academics in Manchester warned this week that a dearth of medical lecturers could put the government's plans for more NHS doctors under threat. Wilfred Darlington reports.
They don't believe in the health service, they never did. They wouldn't invest in the health service.
In July 2000, the Prime Minister announced a major revision of the National Health Service. The NHS Plan promised substantial increases in the numbers of medical staff by 2004.
And it will be our pleasure to rebuild it.
But a major flaw in the plan to rebuild the NHS seems to have been that no provision was made to increase the numbers of medical lecturers. Here at Manchester Medical School, the past 3 years have seen student numbers rise by a quarter, while the number of medical lecturers has very nearly been halved. And according to this recent survey, academic staffing levels have now fallen to crisis point.
We have fewer people with a clinical qualification working in medical schools, and because we have more medical students and more medical schools, that means that the number of students for each member of staff is getting more, and we're relying more and more on our friends in the NHS to contribute to the teaching as well.
Gus McGrowther works both as a surgeon and as an academic. He believes that the lack of a proper reward structure for medical lecturers has made teaching unpopular.
With the rising number of medical students, the NHS Plan promised more teaching places for students and nurses and more consultants. They said there would be 7,500 more consultants, but we don't know where these 7,500 consultants are. So we're faced with the pressure of rising student numbers and really not enough resource to teach.
Clearly, if the country needs more doctors, then medical schools will need more teachers with which to train them. But with more students and fewer teachers, the workload on each medical lecturer has actually doubled.
The knock-on effect of this pressure on teaching is that the patients at the end of the day are just not going to have the extra doctors that are being promised, because there just isn't the resource to train the numbers that have been promised in the NHS plan.
As it is, the United Kingdom, with fewer than 2 doctors per thousand of population, is well behind its European partners. Italy, for example, according to latest figures, has more than 3 times as many doctors. And there is no instant remedy available with which to treat the problem.
Medical education is a slow business. Medical students take at least 5 years from the time they join medical school to the time they qualify. And it also takes a very long time to train clinical teachers and clinical researchers.
Beyond the classroom, there's a huge impact from this shortage of teachers, because it takes a huge time to train a doctor, and then to train in a specialty like surgery, it's maybe another 12 to 15 years. And this means that the resources must be put in right away.
Wilfred Darlington with that report. Well, we asked the government what they were doing to address the problem, but as yet we haven't received a response.